In the part 3 of environmental pathology, we will look at therapeutic drugs and effects of radiation. Combined hormonal contraceptives are classified as carcinogenic to humans, whereas progestogen-only contraceptives are classified as possibly carcinogenic to humans. Current or recent users of combined oral contraceptives have an increased risk of breast cancer, cervical cancer, and liver cancer. There are associated adverse effects such as venous thrombosis and pulmonary embolism. Oral contraceptives increases risk of thrombosis. Cardiovascular disease can also occur. Myocardial infarction risk is higher if they are more than 35 years old and smoking. Occurrence of hepatic adenoma can occur with prolonged use, and oral contraceptive is protective against ovarian cancer. We look at the use of menopausal hormonal therapy or hormone replacement therapy. There is a risk of endometrial cancer and hyperplasia with unopposed estrogen therapy. There's also an increased risk of breast cancer with prolonged use. Venous thrombosis and pulmonary embolism is at a higher risk in menopausal hormone therapy users, but it has a protective effect on the development of atherosclerosis and coronary disease in women under the age of 60. So the risks and benefits associated with menopausal hormone therapy and oral contraceptive pills must be evaluated individually. In the United States, paracetamol causes 50% of acute liver failure cases with 30% mortality. In Malaysia, paracetamol poisoning accounted for 29% of all drug poisoning incidents. 60% of them are suicide attempts. At therapeutic doses, about 95% of paracetamol undergoes detoxification in the liver by phase 2 enzymes and is excreted in the urine as glucuronate or sulfate conjugates. About 5% of less is metabolized through the action of cytochrome P450 to NAPK, a highly reactive metabolite. NAPK is normally conjugated with glutathione, but when taken in larger doses, unconjugated NAPK accumulates and causes hepatocellular injury leading to centrilobular necrosis and liver failure. The treatment for paracetamol poisoning is N-acetylcysteine, which restores glutathione. Aspirin overdose may result from accidental ingestion of a large number of tablets. Overdose is frequently suicidal in adults. Aspirin overdose can cause respiratory alkalosis followed by metabolic acidosis. Chronic aspirin toxicity or salicylism can cause headache, dizziness, tinnitus, convulsions, and coma. Acute erosive gastritis can occur with ingestion of aspirin, causing gastrointestinal bleeding and ulcer. Bleeding tendency can also occur because aspirin inhibits platelet aggregation. When taken together for a long time, aspirin and paracetamol can lead to renal papillary necrosis or analgesic nephropathy. In a normal physiological condition, PGE2, prostaglandin E2, produced by the kidney is necessary to support adequate blood flow to the kidney. The PGE2 depends on cyclooxygenase. Aspirin inhibits cyclooxygenase, so it reduces the PGE2, thus reducing the blood flow. In renal cells, paracetamol is converted into NAPK. NAPK depletes glutathione via non-enzymatic conjugation to glutathione. With depletion of glutathione, cells of the kidney becomes particularly sensitive to oxidative damage. So taken together, the drugs can cause further damage to the kidney. Now we move to radiation injury. Radiation is energy that travels in the form of waves or high-speed particles. There are two types of radiation: ionizing radiation and non-ionizing radiation. Ionizing radiation has sufficient energy to remove tightly bound electrons. Non-ionizing radiation can move the atoms to vibrate, but not enough to displace the electrons from the atoms. Ionizing radiation can cause DNA damage either directly or indirectly via the free radical formation. The DNA damage can lead to cell death, fetal deformity or teratogenesis, or formation of cancer, carcinogenesis. We look now to the factors that influence ionizing radiation effects. Single large exposure dose of radiation is more damaging compared to divided dose of radiation. When the cells are in G2 and mitotic phase, they are most sensitive to radiation. Rapidly dividing cells, such as germ cells, epithelium, are more sensitive to radiation compared to other types of cells. The production of reactive oxygen species from the radiolysis of water is the most important mechanism of DNA damage by ionizing radiation. Hence, poorly vascularized tissue with low oxygenation are less sensitive to radiation therapy. And lastly, presence of damage to endothelial cells may cause narrowing and occlusion of the blood vessel, leading to impaired healing, fibrosis, chronic ischemic atrophy. Cellular mechanism of radiation injury can exhibit themselves in acute effect, fibrosis, and carcinogenesis. The hematopoietic and lymphoid systems are very susceptible to radiation injury. With high dose levels and large exposure, severe lymphopenia and shrinkage of the lymph nodes and spleen can occur because radiation kills lymphocytes directly, both in the circulation and in the tissue. Hematopoietic precursors in bone marrow are also sensitive to radiation, can produce dose-dependent marrow aplasia, which is disappearance of the cells in the bone marrow. Very high doses kill hematopoietic stem cells and induce permanent aplasia. Another effect of radiation is fibrosis, which is replacement of normal tissue by fibrous tissue. This causes scarring and loss of function. It usually occurs in ionizing radiation for cancer therapy. Radiation is associated with carcinogenesis or cancer formation, as seen in Hiroshima and Nagasaki survivors and also in Chernobyl survivors. Radiation may induce genetic instability and cause mutation in irradiated cells. It can also cause accumulation of mutation resulting from persistent, irreparable DNA lesions and also induce secondary leukemia. This picture shows overview of the major morphologic consequence of radiation injury. It can occur in all types of organs. Early changes are seen in the gonads in terms of destruction of testis and ovary, and in terms of destruction of blood and bone marrow tissue. In GIT, it can occur as mucosal injury and ulceration, and in the skin, it can occur in erythema and edema. Late changes occurs in weeks to months. It can be seen in the brain, in the skin, and in the lungs, mostly as fibrosis. There are four radiation susceptible phases in embryo and fetus. Radiation in pre-implantation embryo can kill the embryo. Radiation during organogenesis, which is from implantation to the 9th week of gestation, can cause congenital malformation. Radiation during fetal period from 9 weeks of gestation to birth can cause functional abnormality of CNS and reproductive system. It can also cause mental retardation, childhood leukemia, and brain tumors. And radiation during postnatal period can lead to bone growth and maturation retardation, with abnormalities of the CNS, eyes, and teeth. Lastly, we look at non-ionizing radiation, ultraviolet radiation. It consists of UVA, UVB, and UVC, and the most important protective agent against the ultraviolet radiation is our stratospheric ozone. Repeated exposure to ultraviolet radiation causes premature aging, and it also causes DNA damage, which can lead to malignant and pre-malignant skin lesions. The pre-malignant skin lesion is actinic keratosis, and malignant skin tumor that is caused by ultraviolet radiation is squamous cell carcinoma and malignant melanoma.